All right. Like I said earlier, my name is Neil Gurley. I'm a legal assistant for Cobb Law Group. I'd like to welcome all of you to our second webinar, this one being on the topic of construction safety in the post-COVID-19 marketplace. Our speaker today is Andy Thompson. Andy is the founder and partner in Big Oak Consulting LLC, a consulting company that was created so that Andy and his partner, Pete Herrera, could bring their 30+ years of experience in safety management and leadership to companies both large and small who suffer from stalled or negative culture aspects. Andy has spent over 30 years working in above ground and underground utilities, transmission and distribution infrastructure operations and administration, vertical building trades, and materials testing. Having worked within both healthy and ill corporate safety cultures, Andy has developed a unique skill set as a passionate evaluator and builder of positive and sustainable corporate culture. Andy has worked tirelessly throughout his career as a change facilitator for C-suite executives seeking measurable results through program evaluation, cultural navigation or establishment, program correction, and ultimate sustainability through consistent leadership principles and practices. I would like to welcome Andy Thompson.
Thank you, Neil. I appreciate it. And once again, thank you all for being here today. Not that everyone wants to talk about COVID again, but here we are. The difference is that we're now in what many would consider to be the post-COVID-19 marketplace. And the only reason I say that is because we're starting to see some of the affectations moving forward into insurance renewals, regulation, and other things that will affect us going forward in trying to rebuild a business model that is both profitable and safe for all of us. So that being said, we need to introduce ourselves a little bit to that post-pandemic marketplace. Most times I hear people tell me that things will never be the same. Honestly, between tomorrow and yesterday, things will never be the same, but you need to honestly assess where you and your organization are projecting your pathway back to that profitability and compliance. If you had it before, there's no reason you won't have it again. If it's changed so remarkably because of COVID, okay, that you need to build a new business model, now is the best time. In that regard, you might want to think about doing a new SWOT for a new era, okay, moving into this post-pandemic marketplace. So for those not familiar with the term SWOT, stands for strengths, weaknesses, opportunities, and threats. And it's just as applicable now in a major business change that COVID has brought us as it would have been in any other time when you're looking to make a great business change in your own organization. Releasing pre-pandemic concepts of safety in the old marketplace is a very important thing to do. We can't hold on to what were norms before, okay, because they will not be going forward in this new marketplace, especially in the short term. Long-term culture change affords us the ability to be much kinder, much gentler, and make smaller course corrections over the long period of time. A caring company. Short-term compliance is a little more difficult, and we'll talk about that a little bit. It is a strange new world, okay? We're seeing things happen in our world, in our country today that we never thought we would have seen even 5 years ago. Finding your safety and risk stride in 2021 means finding out sometimes that safety and risk are partnering attitudes if you didn't think of them that way before. Training is going to be different, and risk management will obviously be different. We're going to talk about that. Shopping for an insurance policy becomes an issue as well. And your living compliance documents and record-keeping functions are going to change. The differences, at least the most remarkable ones that I have seen so far, have been in regulatory changes or the promise of same. New government administration difficulties and anticipated changes there. It is no secret that a Democrat-run administration is a little bit different in terms of funding government agencies like Department of Labor and OSHA, and that a Republican might be. Perceived and real damages from COVID-19 are things we're going to talk about in the presentation as well, along with some insurance coverage issues that you may face if you haven't renewed yet. and business modeling for the future, which takes into account everything we've been talking about thus far. The anticipated regulatory changes are likely on the horizon when you see things like what are going on right now with OSHA and exercising of the general duty clause and the respiratory standard for violations of infection control in regard to COVID. If you were to look on, look on the OSHA website and find out where most of their citations are being issued, you're going to see a major list, and most all of them have to do with general duty clause violations and the respiratory standard as relate to COVID. It's a possibility that we could see an entirely new general industry subpart as a result of COVID. I wouldn't be surprised to see that. They take their lessons learned from the Bureau of Labor and Statistics, okay, on injuries and illnesses. And if they have enough reason to believe that a new standard is called for, they will develop one. Lord knows how long it'll take for question and answer on that to make it a reality, but it will happen. A pandemic response plan. A possible transformation of the existing respirator standard into something it was not before. Finding the right elements to include are always a challenge when it comes to building a pandemic response plan. If you have not done so at this point, a pandemic response plan may be an absolute necessity moving into an insurance renewal. Knowing how to incorporate the financial and practical elements in your existing business into that pandemic response plan could be essential. Record keeping of COVID transmissions in the workplace and the Bureau of Labor and Statistics, as I said, could be a very big time challenge. A lot of people are reluctant to report workplace transmission of COVID as an other illness, okay, on their 300 log, okay, but you're going to end up having to do it. Insurance renewals and continual improvement are going to be paramount in moving forward in any kind of business model that's going to succeed.
Andy, I just wanted to cut in here for a second. I forgot to mention that if any of you guys have any questions at all during the presentation, you can go ahead and type those in, and at the end of the presentation, we'll be answering them.
Thank you, Neil. Appreciate that. So in a new government administration, under the Biden administration, you're probably going to see much more support for OSHA, whereas funding was cut in many agencies, the Department of Labor being one of them under the Trump administration. They will probably bring the Department of Labor back up to close to what its previous funding levels were. So that means greater enforcement. It means more compliance officers. It means more compliance assistants, hopefully. Some anticipated federal level changes. Revisions to the World Health Organization pandemic guidance could result, maybe not always will, but could result in an international regulatory change cascade that you may see. The World Health Organization has been hotly debated throughout the entire COVID crisis, and depending on who you listen to, they were not well received by the U.S. government standard. That's not necessarily true. We were picking and choosing a little bit. Numerous federal agencies could install revised regulatory triggers that will allow enhanced federal intervention at the state level during pandemic states of emergency. This could affect your business operations. I would not be surprised to see some sort of legislation coming down the pike, okay, that allows for greater control in previously state-run agencies, or FEMA assistance, okay, in a pandemic situation. Workplace illnesses, to include viral infections transmitted in the workplace, will trigger an OSHA request for your pandemic response plan. I have this from speaking to a few people at OSHA in Region 4, that regulation, although not in place at this point, okay, is going to start asking for potentially, if you've had more than one or two workplace transmissions, maybe more than that, they may consider those severe incidents under the new severe incident reporting plan that's in place over the last couple of years. especially if you've had hospitalizations, right? So that's a way for them to get into your business, so to speak, okay? If you don't have a pandemic response plan in place that addresses those things, or how you're going to mitigate those in the future or handle new cases, okay, you could be looking at some trouble. At the very least, you should have an illness and injury prevention plan. There are models for those well accepted at this point that covers worksite hygiene rules, depending on your type of work. In construction, it can be kind of difficult, but there are things we can do to enhance that, both from an administrative and an operational standpoint. There are real and perceived damages from COVID-19 first. One of them is that people think they'll never find safety and profitability that they had before, as we talked about earlier. You can and will have those things. It's going to take a little time, though. We have had, obviously, the long-term effects are going to be more in the line of, material shortages and higher cost for materials based on those shortages and the demand. And those things will solve out in time. Things will become more expensive, but as parity in the marketplace happens to, work on those issues, you should see some more trust in numbers coming out. They may not be great, but it'll come down eventually, we're hoping. But the important thing to remember about safety is you can actually project manage your way back to compliance, or at least better compliance than you had before. So taking it as an opportunity to rebuild something that is more applicable. I hate to say rebuild better, okay, but now is your chance to do it. First off, to try and do that, consider performing your own SWOT, as we talked about earlier, strengths. Look at the strengths you have in this organization, okay? You're going to be building a future for yourselves that includes safety culture, risk management, more enhanced. These are all going to be different but manageable for you. Look at your weaknesses and define those weaknesses very well and honestly, or the barriers that are in place that's related to finding new normals. Okay, we've all talked about a new normal, but we're not there yet. New normal means we can depend on going to church every Sunday, or either wearing a mask or not, but it said it will be open. As an example, that these things need to be compliant and work for you. Strengthen or eliminate these weaknesses. There is no I can't. If you approach from an I can attitude, you'll never be able to succeed. Opportunities, recognize those opportunities that are going to aid you in getting to that corporate project new normal goal. Don't chase rabbits. That means that there are going to be people coming to you with promises of this, that, and the other thing. Things are going to change this way. I promise you my pricing will change, or I promise you this will never become regulation, or I promise if you purchase this program, you're going to be in compliance, and so on and so forth. Get a really good set of recommendations on how to move forward and be cautious, okay, about those extra costs up front. Threats, define the threats to the goal itself. Those you can eliminate should be dealt with. Do the hard things. Those you can't eliminate should be recognized and mitigated or regulated as well as possible. Right? So doing the hard things in the midst of COVID, I've noticed is a very difficult thing for people. We are all empathetic of people, their livelihoods, business models, for example. A lot of people's aspirations and difficulties made more difficult by this crisis. Once again, recognize that doing the hard things gets you to doing little things that are much easier at the end of the day. Bringing in an outside consultant to aid in performing an accurate SWOT will go a lot further, truly, towards finding both your administrative and operational solutions for these things. A SWOT is traditionally done by an outsider in the first place. I don't say you have to do that, but I would highly recommend that you find an outsider to come in and look at your organization. They're going to be much more honest about seeing the perceived and the real damage and relationships between your people and what is out there that could be in your way towards getting to this new normal. Real damages from COVID-19, the reinsurance market, big time. Just been through some insurance renewals. These costs are going up. The reinsurance market capacity has shrunk due to COVID-related policy changes in regard to excess coverage specifically. This is forcing larger carriers to take excess policies back in-house, resulting in 10 to 30% increases in excess coverage premiums across the board. Don't take my word for it, talk to your insurance broker. If you've just renewed, go back and talk to them again every month. Okay, like make sure you know what's going on in that marketplace. Okay, account for that cost. Premiums are expensive. The larger your company is, the less likely you are to see the higher level increases. Okay, so be aware that those coverage increases are going to be there. The other thing that has cost a lot in the excess marketplace are shock loss case values have gone up tremendously in the past 4 to 5 years. I hate to say this, but cases of a fatality that may have been settled for $4 to $5 or $6 million are now going for the $17 to $20 million range. That's driving all those costs up and the smaller coverage companies out of business. Insurance coverage for contractual obligations is an increasing cost, not due to current increases in claim activities, but due to anticipated claims activities. This is how underwriters look at things ahead of time. They're looking at all these claims on contractual obligation that could be coming in the next 6 months to a year, okay, and they're adjusting the price of the market that way based on their capacity. So seek out the good folks at Cobb Law for guidance on contract language in the new marketplace, because they can definitely help you achieve your goals. And then again, wherever you might have simply checked yes on a box on an application for insurance coverage, you should expect renewal questionnaires to be far more discerning as carriers attempt to quantify that risk for underwriters more than ever before. That is a real thing. If you've ever, depending on the size of your company and how, whether or not you've been renewing year over year with the same carrier and not had to go through the entire application process over again, think again. Okay, if you're shopping for insurance and your broker wants you to move to another large carrier, you're going to be buried in paperwork. Real damage training costs are going to increase. These are some of the soft things, and I mean that by saying these are right in front of you and you know what they could cost. There's undoubtedly going to be new training that arises from increased regulatory activity and your own need to comply with regulation and insurance requirements. For example, if the respirator standard changes to increase or to include COVID changes, you're going to need to retrain your people on that. You're going to need to have proof that you've done it. That documentation is going to be paramount. The general duty clause, once again, make sure your people in the field understand what it means to comply with COVID regulations. If anyone is aware of it, the defined structure for citations under OSHA has gotten tremendous. Right? So a willful citation is over $130,000. Okay. The other than serious is obviously $13,000 plus. At this point, we're going to see carriers start to drop some of those higher risk clients. Okay, and you're also, like I said, going to see excessively high renewal quotes, because there are simply some companies out there that have been lucky over time. Many will have not reported their injuries accurately in their 300 logs. That's not going to get by anymore. You're not going to be able to do it. You can't continue to operate that way on luck, okay, and some creativity. Carriers could drop companies like those in favor of a more structured and compliant applicant, so you may as well get ahead of the curve and be one of those companies to begin with. As I said with insurance, start your renewal process now. Don't wait, do it now. Contact your broker to listen to their assessment of the reinsurance, general liability, comp, and auto coverage lines post-COVID-19 and whether or not your current limits need adjustment in the next term. With the expense that's out there, depending on your company and your anticipated revenues, you may want to reduce some of that costs in terms of the excess insurance. Who knows? Listen to your broker. Look again to a law firm like Cobb Law to help you revise contract language to your best advantage in an expensive insurance market, because it's going to be that. Begin working on what you're going to need to gain the lowest renewal quote possible, because it still be beneficial to stay with it may not still be beneficial to stay with that long-time carrier. Don't forget that carrier has got all of your experience history. Okay, so it may be a little more expensive to stay with the long-time carrier, okay, over some other quotes, but you got to weigh that against the cost of trying to apply and move into a new carrier in the marketplace. When you need help with building programs, ask for help. Companies like Big Oak can provide a wide variety of enhanced programs and implementation solutions that help your organization becoming more marketable to insurance carriers and clients, right? Insurance carriers are the greatest friend of my business because they love what we do in terms of posturing people towards being better risks. Municipal and private clients are going to be looking for those positive, safe cultures and risk additions to your business as a matter of future contractual compliance. Business modeling for the future. At the beginning of the presentation, we talked about business models. We've all had to shift and change business models to account for COVID and what's going on. Less staff, remote working staff is great for some places and not for others. In construction, well, obviously nothing gets built unless we have people in the field. Always review your health and safety compliance model, no matter what, COVID-19 notwithstanding. Okay, there are always changes and additions and improvements that can be made to it. COVID-19, although arguably the most significant challenge to business today, isn't always going to be the #1 challenge. As time goes by, we will get through this. Things will be a little easier. Okay, the expense will have changed. Okay, and where we spend money in insurance and compliance is going to change, and it will change for a long period of time, but it will become the norm. Shorter-term challenges require more decisive and less culture-friendly decisions in regard to discipline for safety infractions such as infection control policy, failure to follow, for example, contact tracing and quarantine your people, or other short-term or temporary COVID-related regulations. Now, there is regulation, there is guidance, and there's policy. Your policy may as well be regulation if you don't follow it. Long-term culture change taking place over multiple years and decades, as I said earlier, does have the luxury of a more relaxed steering of that culture in a more nurturing environment. But once you're in a short-term COVID regulatory environment, you must be strict about following those regulations and documenting everything you do. Otherwise, it could lead you down a very expensive road in the short term. Use the learning gained from your SWOT and rebuild your business model to incorporate the items that are required for a sustainable positive change, right? No change is good unless you can sustain it. Turn a negative into a positive. Use this pandemic affectation to realize a long-term benefit to your business. If you don't, you've kind of wasted the whole of the negative environment that's been created. So if you can't turn a negative into a positive, you got to work a little harder, unfortunately. This is the meat of what I wanted to talk about. Right off the bat, do we have any questions?
It does not look like there are any questions yet, but that might change.
Okay. Want to talk a little bit about performing a SWOT in your business. That SWOT, if I could look and see if anybody has ever had one done before. I don't know if we can get a raising of hands that way.
There is a raise hands feature if anyone wants to raise their hand. Obviously, you don't have to. Oh, we got one.
Okay, so if you've had a SWOT done before, okay, I am curious to find out from you whether you learned anything from it. And if you did it help you solve a long-term sustainable challenge, or was it simply done for a short-term correction? Because in the COVID world, that SWOT can easily be mistakenly performed to solve a problem that is only COVID related. So when we're going to do a SWOT, okay, in relation to moving past COVID into a world after COVID, we have to think about the long-term effects of what we're trying to accomplish. So
Carmen says that the SWOT that she had done was for short term.
Was it for a short-term goal?
Yes.
Carmen, does that short-term goal continue to be corrected?
Oh, my bad. Carmen is a guy.
Ah, sorry, Carmen.
My guy. I'm sorry.
'Cause I want people to think about trying to use this SWOT to make a really good course correction and a safety program that might need some help.
Carmen says that we have moved on from it.
Gotcha. Well, that's good. But if you don't have a strong safety culture right now, or don't know what it is, the SWOT can help tell you what it is. In a regulatory environment like the one we're going to be witnessing very shortly, having a communication out there that helps everyone understand how the SWOT works would be helpful in trying to find your way towards complying with those regulations. Insurance requirements are going to be part of your program and are going to drive a lot of what you do and specifically don't do moving forward in a post-COVID-19 world. So let's see. So of the panelists, does anyone know, who knows when their insurance renewal comes due? And has anyone renewed very recently? The reason I asked the question is because I'm looking to find out if they've seen the increased costs of renewal now, or whether they're starting to, or whether they're going to be confronted with them in the next 3 to 6 months.
Carmen says not yet, but soon.
Not yet, but soon. Okay, so once again, Carmen, I would be calling your broker to find out what it looks like, because I don't want anybody to get a shock when they hear about this 10 to 30% increase for your excess, your auto, and your workers' comp. These are going to be expensive. Training. If you have not trained anyone on the respirator standard completely at this point, I would consider doing so, because whatever happens will be in addition to the existing respirator standard. And this is what OSHA and other compliance agencies are looking at right now in terms of your compliance in a construction organization with COVID-19 regulation. Once again, documentation is paramount with those things. Now, the pandemic response plan that I mentioned earlier, if anyone has built one, I want to make sure that they build it into their safety programs, not as an integral part or section of the manual, but as an addendum to it. The reason I would say this is because you have a living document there that needs to be changed on a very frequent basis, especially in this phase of recovery from COVID. At the very beginning, back in March of last year, we had regulatory change every 3 to 5 days, it seemed like. And it was very difficult to keep up with a policy and a plan. So if you adopt a policy and you put that out for your people that covers what to do if you feel ill and so on and so forth, and everything having to do with contact tracing, live by that document, but make it overly broad to regulation, and not just regulation, but to CDC guidance. CDC, once again, is guidance. It is not law. Okay, but if you follow a broad sweeping policy in terms of CDC's guidance, and regulation makes sense for you, you're going to be in far better shape. And then once again, you'll have a living pandemic response plan document that you can incorporate into your safety program manual as an addendum, not as an incorporated section. If you do that, you'll be ahead of the game of most people. I was wondering if anyone has a pandemic response plan already built, and if so, what model they may have used to build them, as a question. We'll take that as a no.
Doesn't seem like anyone does. I
A
will
lot
let
of-
you know if the answers it though.
A lot of people have asked me where they can find a template for their pandemic response plan, and what's required by the U.S. government. The U.S. government doesn't have an official recommendation for a pandemic response plan. But what you can do is you can go to the World Health Organization to find a template for this, which could be a bit burdensome. If you'd like, you can talk to me at some point after the presentation, and I can help you with best practices towards building one of these things. It needs to be built and tailored to your organization, and not necessarily overly broad and burdensome, so to speak. And so if you have illnesses from COVID, you have COVID transmissions within the workplace that you end up having to report to OSHA, you're going to want to have that available, because they're going to ask you if you have one. Right, that was the next question. I try to anticipate those questions, the what ifs that come along with some of the poor things that happen. Let's see. Some of the right elements to include in your pandemic response plan. Obviously, what you're going to do, what you've done in terms of shielding your specific operation from COVID as best you can, whether you're doing temperature checks, how you are recording what you are doing, who comes and who goes, what has happened with people who have said they are sick. You may also use things like teledoc to get a confirmation of whether or not that employee should be going to take a COVID test or is okay to come into the office. You really need to dot your I's and cross your T's before you've broken the barrier, so to speak, to entry into your building. Many people are stopping people at the front door and not allowing them access, or intercom access only, and then they'll have to sign a COVID declaration that states that they have not had COVID. They have not been exposed to anyone who's been diagnosed with it in the last 10 days now instead of 14, and that they are not feeling any symptoms or symptomatic in the least bit. There are also touchless ways to reconstruct, so to speak, your building entryways and doorways. There are a number of touchless pulls you can add to keychains. There are ways to tongue blanks for doors, for example, to where you can grab and pull something without using a latch. Increased cleaning. At the very beginning of the COVID crisis, OSHA came out with a table of approved sanitizing spray products. Of course, no one could find any of these things the second they put the list out, and then people were quickly walking back to some non-traditional ways of cleaning, finding alcohol and whatnot. I've had a lot of people ask me what your exposure is in regulation if you're using cleaning products that are not approved by OSHA. I would say very small, as long as you're using your best reasonable effort to comply. Okay, so, and you're trying to comply with the elements of the general duty clause that state you must supply a place of work that is substantially free of hazards that are recognizable to you. If you cannot get Lysol spray, for example, you need to find another way to comply. It's almost the same as, finding using a piece of tie wire for an air compressor hose instead of a pin that's made for it, so to speak. This happens quite often. Let's see. Incorporating the financial and practical elements of a pandemic response in your existing business plan. The pandemic has cost everyone, has had and incurred increasing cost to everyone just to operate. Many people are fogging their buildings once a month all the air intakes with hydrostatic spray or sanitizing spray, which is a wonderful practice, especially if you can't find the right cleaning products. But you need to try and find a way to incorporate some of these into existing general administrative cost. And I say that not because I want them to stay there permanently, because you're going to end up replacing them with something else at some point and shifting those numbers around a little bit to something that makes sense. For example, that hydrostatic fogging that costs $1,500 a month, okay, could now be taken up by training that has changed in response to the pandemic and some of its affectations. It can also be absorbed in administrative cost of managerial staff responding to these things. I know, for example, a lot of human resource departments are hiring additional personnel to handle daily checks for construction employees on job sites, for example. Many people have hired outside agencies to come and do temperature checks as a gateway to entering a construction site. Depending on what your organization does, that's not a bad idea. You have a record that says that person's been checked on his way into the site each morning and has declared that they are not feeling symptoms. But all these things come at a cost, and it's not going to go away immediately. So building those financial elements into an existing business plan make tremendous sense. So the record keeping of a COVID transmission in your workplace between two individuals while at work, instead of each of them getting or contracting the virus at home. If you're going to record that, you need to have a great way of proving. If you're not going to record it, I should say, you need to have a great way of proving that the contact trace came from outside the workplace. For example, if you have 4 employees who carpool to work every day, okay, in a company vehicle, the minute they got in that company vehicle at your company location, okay, they were exposed to one another. And if they spend an excessive amount of time in that vehicle, and one of them is COVID positive and transmits to 2 of the others, you're never going to be able to prove consistently, unless you've got some really good evidence, that they contracted COVID outside the workplace. Because once they get in that vehicle that's owned by your company at the company yard, okay, you're beginning to own that. So recording it in your OSHA 300 log should go under other illnesses, and the description of incident or injury or illness ends up being contracted COVID-19 in the workplace. I would leave it at that. Paint a broad brush with it and see what ends up happening with OSHA. Depending on your corporate code, in construction especially, if you've got to post your 300 log either in a BLS audit or electronically with OSHA, we're still waiting to find out what happens. It is still January, but I have every reason to believe that OSHA is going to be doing an awful lot of research and is probably engaging the Bureau of Labor and Statistics to do much of this on as many COVID transmissions in the workplace as they can possibly find. That is going to help them to create law. It's going to help them to create or approve new products through the National Institute or through the NIH and through NIOSH, and should give us some really great data on how this moved and where. I've seen a lot of cases come up through worksite transmission cases come up through things like that carpool. You don't think about it as much because we think about things happening on the workplace, but the minute they're gathered together, there you have it. Even had an accident, a vehicle got into an accident. It wasn't specifically the virus, but this vehicle accident was caused because someone had put somewhat clear shower curtains up in their vehicle to try and separate their people inside the vehicle. And the driver couldn't see, went to make a lane change and ran into another car. You have some common sense about these things. So once again, if you can't provide distancing and barriers to COVID transmission within the workplace, you're not doing enough. So in some cases, vehicle pools just don't make good sense. Let's see. The only illness and injury prevention plans are not something new. They've been around for a long time. If you're not used to building a program document like this, that might be a good place to start, because it's an existing document and there are many, many, many templates out there, and they are built around illness, so to speak, more than individual injury. So if you were to build this as a building block for your either pandemic response plan or company policy having to do with COVID, you might be better off as a starting place. Once again, if you need help with that, Big Oak is more than able to help you with those things. An IIP may also serve as your interim guidance document, okay, in terms of how you deal with COVID. So immediately, if you had a request from a regulatory agency and you turned over an IIPP, okay, that is designed for COVID, would likely be in compliance with having a policy and an interim policy document in place. If you don't have anything in your arsenal that says this is an interim or at least a temporary policy designed around COVID, you probably should be doing that. For one thing, it gives employees a place to go. Okay, and at the same time, you may be bound by those things with your employees, but if you cover it well, and the broad brush at the very least has those employees who have questions making a phone call if there's an issue, or not coming into the workplace when they do not feel well or feel a symptom or have heard of a transmission at home, you're in great shape. The only issue I've seen thus far are people who either don't read it, don't remember it, or don't refer to it. In this case, if you've got that broad brush policy, it doesn't need to be anything pretty, nothing fancy. It needs to cover your basic bases. You can go into building a response plan later, okay, and once again, build that as an addition to your existing program manual. If you want to, at the end of it, if your IIPP is detailed enough, many are more detailed than others, that may actually cover most of the elements of a pandemic response plan. I'm not going to say it covers all of them, because at some point U.S. regulation is going to come out with a recommended pandemic response plan for companies, unless they turn it into regulation. So at some point you need to have something in writing that says how you do it and who you do it with, and start to finish how you treat a case depending on what it is. Let's talk a little bit about contractual obligations in contracts and the terminology for such things. Your obligations in a contract, the language that's written in a contract may sound great to you and you may believe that it covers you for everything you think it does, but I really would suggest you talk to somebody like Cobb Law about guidance on those things. There are certain elements of, as we all know, of contractual, obligation and language that are acceptable and some that are not. And Cobb Law are more well placed to answer those questions. I wonder if anyone's out on the webinar has ever been dropped by a carrier, and if they have, whether it was because you had insufficiencies that you were unwilling to correct. But the only times I've really ever seen this are in subcontract agreements. So if you're one of those smaller companies that has a will and a handshake between subcontractors and you, your insurance carrier tomorrow is not going to want to insure you the way they used to. Okay, they're going to want to have that binding language that brings our liability to an end here and picks up theirs, picks up here, and indemnification and so on and so forth. And in that regard, and especially in regard to COVID, okay, and complying with those regulations, you're going to want to have subcontract agreement, okay, that covers your insurance requirements, your new insurance requirements. Don't forget to upgrade or change or revise your subcontract agreements based on additional costs you may need to incur and so on and so forth. Try to qualify subcontractors before even bringing them in. Just makes life easy for everyone. Project managers can many times get a little overzealous when they find someone, but then find out you can't be used if they don't have proper insurance. Let's see, dump truck drivers can be great at that sometimes, trying to find their insurance required, their required insurance. Let's see. So the atmosphere seems to be built around survival of larger companies, okay, that have a little bit deeper pockets than it does the smaller company at this point. A lot of people have asked me in the future what that looks like for the small company. And although it sounds bleak, I would tend to think that you'd have a little more to look forward to because of increased opportunity as a smaller carrier or smaller company, so long as you can find insurance in those limits. Bigger companies are struggling sometimes to organize themselves properly to deal with some of these costs. It's not to say that they don't have more power to bid with, but smaller companies sometimes can find their niche a little bit better. I've heard a lot of people talk about the PPP loans and some of the issues that have to do with those. The IRS is asking them how they've used it and proved that they used it for, payroll and things of that nature. And some of these people haven't even received a PPP payment. Who knows? The federal government's a little bit on the catch-up side right now. Let's see. Neil, that's about all I have.
All right. Are there any other questions? Pretty much the question chat was just Carmen responding to you the whole time. I don't think anyone else really asked anything. I'll give about a minute and a half if anyone wants to get a question in. And while we're waiting for that, I just want to go ahead and mention that we're having another presentation via GoToWebinar on Thursday. If you're not already signed up for that, it'll be on the topic of Georgia's new lien waivers. And Mark Cobb will be presenting on that. And he presented on it last week, and it was a great presentation. But I think this one's going to be a little bit more fine-tuned since it's the second go-around. So we would love to have anyone that would like to sign up for that there. And also, if you or your colleagues would like to watch this webinar again, you can contact me at Neil, that's N-E-E-L, at cobblawgroup.net, and I can send you the link to the recording as soon as we conclude here. All you have to do is just shoot me an email. And again, that's Neil, N-E-E-L, at cobblawgroup.net. All right, doesn't really look like we have any other questions, so I'm going to go ahead and end the webinar here. Andy's contact information is on the screen if you want to get in contact with him. And I'm just going to go ahead and say, or remind you guys that if you want the recording or want to contact us, you can shoot an email to Neil, that's N-E-E-L, at cobblawgroup.net. Thank you guys so much for coming. We really appreciate it. Have a good rest of your day.
Thank you all.